are talking about the cardiac system, which we call as a circulatory system, that heart system. First we wanted to start as a preliminary knowledge about the anatomy and physiological part of the cardiac system. Further we'll move on to the traditional Chinese physiology. Now let's start the heart anatomy by looking the heart itself. You can able to find out the different parts of the anatomy of the heart. So you just see, I wanted to tell you by looking the image. So just focus on the image, certainly you'll get much more idea about the cardiac system. Number one, you just see on the left side there is a superior vena cava and then inferior vena cava on the image, right? When you are sitting on your left side, you can see. So what exactly this superior and inferior vena cava? These are the two canals. These are the two tubes. So these tubes carries the entire system of the deoxygenated blood of our body. For instance, the superior vena cava is taking the deoxygenated blood of the upper part of the body to the heart, that is especially on the right atrium. So now you can see deoxygenated means there is a less oxygen and more carbon dioxide, right? Whereas an oxygenated blood is there is abundantly oxygen within existing mode. So now you can see the superior vena cava is taking the blood of the venous blood, that means is the drainage of the blood, or not oxygenated blood is taking from the upper part of the body through that superior vena cava, whereas an inferior vena cava is the lower portion of the heart wall, that means the venous system is passing through that, so that blood is taking from the lower part of the blood. So lower part of the body blood, which is the venous blood, is taking for what? For the purification, right? So now let me see, there are the four chambers in the cardiac system. What are those four chambers? You can see on the right atrium, then right ventricle, right? Whereas on your right side, you can find there is the left atrium and then left ventricle. When you turn this image, because of this image is opposite to us, so when it is existing on the right side, this is the right atrium. So this is the right atrium, this is the right ventricle, this is the left atrium, this is the left ventricle, right? The maximum the heart where is located, it is located oblique direction towards the left side of the chest. Especially this is located on the thoracic cavity, right, where exactly midway between the two pulmonary organs, which were called as a mediastinum, right? So in between that heart is located. This heart is generally 210 grams to 300 grams of the heart is located each adult. For example, women have 215 grams, whereas in male having the close to 310 grams of the weight of the heart, which is existing in the mediastinum, right? So now you can see this cardiac system around 10 centimeter long is located in the chest cavity, and now you can see the various chambers. So these chambers are functioning in our body to bring the blood to the heart and for the deoxygenated blood from the right atrium. Then through the right atrium, that blood moves to the right ventricle with the support of there is the valve. You can understand the heart, how many valves are there? There are totally 4 valves are there, right? So first valve called as a tricuspid valve, then the next one is bicuspid valve, are also called as a mitral valve. then the next valve is pulmonary valve, and the fourth valve is aortic valve, right? So now this I wanted to use. So what is the physiology of the tricuspid valve? Tricuspid, the name itself, it gives the information. Tri means is the three cups or three flaps. So which is existing here? 1, 2, 3. So where the in between there is the right atrium, the impurification blood is moving to the right ventricle. When that valve gets open, that goes to the right ventricle. From the right ventricle, then this moves to the pulmonary artery that goes to the pulmonary system, that is called as a lungs. So lungs, they get the purification, that blood converted in the form of carbon dioxide blood to the oxygenated blood in the purification form with the pulmonary system. From the lungs it comes to the again on the left side, so that called as a left atrium. From the left atrium the blood passes to the left ventricle with the support of one valve, that valve called as a bicuspid valve, or we call as a mitral valve, right? So bi means is two, right? There are the two flaps or two cups or two curves slightly. Through that it opens, then that blood moves to the oxygenated blood moves to the left ventricle. From the left ventricle there is the biggest artery in our body. We all know that is the aorta. So through that aorta it goes to the circulation in our body. That circulation called as a systemic circulation. Systemic means it is the entire system of the body. It moves the blood to the across the body from the top to bottom, right? So now the pulmonary circulation, it is circulation from the downwards direction, where we call as a right ventricle, to the lungs through the valve which called as a pulmonary valve, right, for the purification. The artery carries here you understand, always the artery carries the oxygenated blood, whereas in the heart, that is the pulmonary valve carries the deoxygenated blood, arteries. But veins, the left pulmonary veins are carrying the oxygenated blood in the cardiac system, and remember this always, right? So this is the overall physiology. Then again aorta is divided into common carotid artery, and then right carotid artery, etc. So whereas in heart itself will supply the blood, so that blood which we called as around 5% of the purification of the blood is supported to the heart itself with the support of two arteries, those arteries called as a coronary artery. Right side supplies to the right side of the heart, and left side coronary artery supplies to the left side of the heart, right? There are the coronary sinus, which we called as the blood itself which is existing within the heart system. After absorbing that, the venous blood carries the coronary sinuses, which carries the deoxygenated blood for the further purification with the help of the superior and inferior vena cava. Myocardium, the inside muscles called as a endocardium, right? So in between the right and left ventricles divided, so that divided which we call as a interventricular septum. Interventricular septum, you can see here midway between the two ventricles on the lower portion of the heart, and separating that, and that called as a interventricular septum. So now let's see, there is the normal heart. So how it looks. This looks like a normal heart. It's a functioning step by step because of at the time of the birth. In a prenatal itself it start functioning. Then post-natal certainly it starts, and then till end of the life it continuously functioning in our body, which we call as a cardiac output also. This is the what we call as a the heart causing the 4 different kinds of the sounds. So those sounds which we call as a lub and then dub. The 2 sounds are invisible sounds. The first sound is getting when the right atrium and then right ventricle, the walls gets closes, so that get the sound, that sound called as a lub. Lub is the very biggest sound, around 0.1 second that gets the, that is 0.1 second that sound will get. So it is the very biggest sound, lub. Then dub, it is slightly lesser than that, that get the 0.4 second, that kind of the softer than the lub. So lub and dub, why? Because of we place the stethoscope on the cardiac system where we need to find out the sounds about the what kind of the, it is the normal rhythm or it is the abnormal, we wanted to know. So for that certainly we try to find out the right atrium and right ventricle get the constriction, so that causes the sound called as a lub. And then dub sound we will get the where the pulmonary valve and aortic valve get the construction and dilatation. So that time we will get the lub sound. The other sound is non-invisible, sound and cannot audible that. So however this you can see there is a mitral valve, I told you, aortic valve. So we supply, aortic valve means through that valve is supplies to the entire system of the body, right? So before go on to this, so to the TCM physiology, we wanted to know there are the conduction system to be taken place in the cardiac system. What are those conductions? What are the kind of the electric current is passing inside the heart itself, which we call as a natural, pacemaker, a natural pacemaker. So that makers are getting the conductivity from the heart system. Those system called as there are the 4 places, so which we call as a SA node, that is sinoatrial node. Sinoatrial node, so where from the right atrium the conduction starts, where on the right atrium the SA node we call as a sinoatrial node, the first conduction taken place. That conduction travels to the AV node, atrioventricular node. Atrioventricular node, so where exactly in the downwards direction, so that travels to here. Then atrioventricular node passes and current passes and travels to the bundle of His. So bundle of His are located midway between the septum of the 2 ventricles, and then Purkinje fibers we call as a PF, that is Purkinje fibers. So that ultimately passes to that lower portion of the heart. So in this way the cardiac system, we all know the electrocardiograph, ECG, also called as a EKG. So these both are same, but this together, this is one kind of the electric current passes into the cardiac system to regulate the cardiac system. We say that every time cardiac system impulses is passing inside. So how does it happening? Because of that conductivity system, that electricity is naturally passing in the cardiac system, which is regulating our outflow of the blood and intake of the blood, and also the PQRST values what we are going to see in the ECG. All these things are correlated to the cardiac system based on the conductivity system. If thus conductions are good, and certainly there is a normal healthy heart. If there is a conduction is not good, and then that what we call as a coronary arteries which supplies to the cardiac system, it abundantly not move to the heart. So maybe it is a single vessel blockage, or the double vessel blockage, or the triple vessel blockage. So like that there are the numerous gets the blockages. So in the primary stage of the blockages are there in the cardiac system, perhaps 10%, 20, 30, 40%. So even this condition also we need not to worry. So there are the certain collaterals which is existing within that cardiac system, and that will bifurcate the energies, or open up the branches and collaterals in order to flow the blood and chi together. So therefore always remember, when there is a small percentage of the blockage in the cardiac system, we need not to worry about it. But how to maintain and how to do the prevention for the future, that's most important. Then 50% blockage is there, there is asymptomatic, no symptoms at all. Again, you are not taking care for the further management and prevention, then certainly that leads to the 70, 80, 90, then even more than that. At the last moment and at the termination stage, the myocardium infraction, that means the myocardium is the muscles, so which get the ischemic, that means the insufficient of the blood, or maybe there is a total blockage of the blood, so which causing the problem to the cardiac system to get the cardiac arrest, which we call as sometimes the patient instant or immediately as a silent killer is we call as a MI, myocardial infarction. So therefore you remember that when there is a mild to moderate symptoms are existing within that, certainly we need to understand and rule out somewhere there is a problem with the cardiac system. We need to regulate all the system of the four chambers, also very crucial here. So systolic blood pressure and diastolic blood pressure all are regulated by the contraction of the atrium is the systolic blood pressure. Diastolic of the ventricles, that is called as a diastolic blood pressure. So already I told previous week on how and what is the normal level of the BP and what are the reasons for the hypertension and what are the solution for that, what are the certain points to be activated to bring down the immediately blood pressure by activating the vagus nerve on the cervical region and the neck region and all, right? So many points I have given. So based on that also works for the cardiac system.